Good morning, everyone. Today we'll be discussing an introduction to physiologic therapeutic modalities, covering key terminology and taking an in-depth look at low-voltage direct current therapy. To be successful in this course, I recommend reviewing the material after lectures and before attending the associated lab. Focus on grasping the key, overarching points, some details you'll simply need to memorize, but don't panic. Ask questions whenever you need clarification, and maintain an active approach to your learning. By the end of this session, you should be able to differentiate frequency from wavelength, identify common acute and chronic signs and symptoms, understand the basic frequency groups and their physiological effects, and recognize indications and contraindications for various therapeutic modalities. First, let's define physiotherapy. It is the use of physical agents like temperature, electricity, light, sound, vibration, forces, and water for therapeutic purposes. Note that physiotherapy is distinct from physical therapy, though the two terms are sometimes used interchangeably. Next, we'll explore the difference between frequency and wavelength, two crucial concepts in this field. Frequency refers to the number of cycles or pulses per second, measured in Hz, Hz. There must be a complete repetition for it to be considered a frequency. Wavelength, on the other hand, is the distance covered by one cycle of the current, typically measured in units like kilometers, meters, millimeters, and so on. Wavelength is inversely proportional to frequency. As wavelength decreases, frequency increases, and vice versa. Let's now classify therapeutic modalities based on their frequency ranges. Low frequencies, from 0 to 1000 Hz, are used for superficial muscle and nerve stimulation, with a treatment depth of less than 1 inch. Examples include low voltage direct current, LVDC, high voltage direct current, HVDC, Faradic wave current, sine wave current, square wave current, transcutaneous electrical nerve stimulation, TENS, and microcurrent electrical nerve stimulation, MENS. Middle frequencies, ranging from 1000 to 100,000 Hz, are used for deep muscle and nerve stimulation, with a treatment depth of around 1 inch. Interferential current and Russian stimulation current fall into this category. High frequencies, from 100,000 Hz to 1 by 10 to the power of 10 Hz, are used for deep heating, with a treatment depth of approximately 2 inches. Ultrasound diathermy, shortwave diathermy, and microwave diathermy are examples of high-frequency modalities. Ultra-high frequencies, above 1 by 10 to the power of 10 Hz, are used for radiation and/or convection, providing superficial heating with a treatment depth of less than 1 inch. Infrared radiation and ultraviolet radiation are two common ultra-high frequency modalities. To better understand how these modalities work, let's review the different modes of heat propagation. Conduction involves heat transfer from hot to cold via molecular collisions between objects of different temperatures. Convection occurs through the stream of air or water, transferring heat by direct contact with a circulating medium. Conversion is the process of changing non-thermal energy into heat through resistance or friction. Finally, radiation involves the transfer of heat from one material to another without direct contact, through waves or particles. The effectiveness of heat transfer depends on tissue conductivity, which is directly related to water content. Tissues with higher water content, like muscle and tendon, have better conductivity compared to fat, skin, and bone, which have lower water content and poorer conductivity. Moving on to inflammation, a key concept in therapeutic modalities. Inflammation is a localized response characterized by 4 cardinal signs: redness, rubor, swelling, tumor, heat, calor, and pain, dolor. A 5th sign, loss of function, is sometimes added to this list. The inflammatory process follows a specific phase sequence. It begins with vasoconstriction, followed by vasodilation, which is considered the hallmark sign. Next, circulation slows down, leading to increased permeability and blood viscosity. Then, white blood cells infiltrate the area, followed by exudation and eventual stasis. Inflammation is mediated by various substances produced by cells like fibroblasts, adipocytes, macrophages, and leukocytes. These mediators include serotonin, histamine, bradykinin, prostaglandins, lactic acid, and lysosomal enzymes. It's crucial to differentiate between acute and chronic inflammation, as they present with distinct clinical features. Acute inflammation, lasting up to 4 days, or up to 14 days in some cases, is characterized by constant pain, increased pain with activity, pain at rest, diffuse pain, cardinal signs of inflammation, and potential sleep problems. In contrast, chronic inflammation, lasting beyond 15 days, typically presents with intermittent pain, pain during activity but not at rest, localized pain, and the potential absence of cardinal signs. Sleep problems are generally not associated with chronic inflammation. Let's discuss the basic frequency groups and their physiological effects, sometimes referred to as the BFGs. Frequencies between 1 and 10 Hz induce vasoconstriction, while those between 20 and 40 Hz promote vasodilation. Frequencies from 40 to 80 Hz are used for muscle stimulation, and those between 80 and 250 Hz have an analgesic effect. Before we dive into the specifics of low voltage direct current, let's cover some essential apparatus terminology. A fuse is a safety device, a rheostat controls resistance and intensity, a rectifier converts alternating current, AC, to direct current, DC, and a transformer alters voltage levels. Two important laws of physics to keep in mind are Van Hoff's law and the principle of heart rate change with temperature. Van Hoff's law states that for every 10 degrees Celsius increase in body temperature, cellular oxidation rates increase by a factor of 2 to 3. Regarding heart rate, for every 1 degree Fahrenheit increase in body temperature, the heart rate is expected to increase by 10 beats per minute. Understanding the concept of depolarization is also critical. The rheobase, or threshold, is the minimum strength of an electrical stimulus required to produce an action potential. According to the all or none law, increasing the stimulus beyond the threshold will not affect the length or duration of the action potential. Additionally, rapid stimuli at high frequencies can result in the inhibition of muscle contraction, a phenomenon known as Wedinsky inhibition. The Raymond-Dubois law states that a change in current can stimulate an action potential. Notably, during the relative refractory period of depolarization, a strong change in current can still produce an action potential. Let's familiarize ourselves with some essential electro terminology. Phases refer to the portion of the current graphed from a point of zero to the next time it crosses zero. Phase duration is the time from the beginning to the end of a single phase. Pulses, on the other hand, represent the graphed current from its starting point until termination. We have biphasic and monophasic pulses, differing in their waveform patterns. Pulse duration and wavelength are related concepts. Pulse duration refers to the time between the onset and termination of a pulse, while wavelength represents the distance covered by one cycle of the current. Other important terms include rise time, which is the time it takes for the current to increase from zero to its maximum amplitude, and ramp up, which represents the value from zero to the current's maximum amplitude. Decay time and ramp down are the opposites of rise time and ramp up, respectively. Finally, the duty cycle refers to the amount of time the modulated signal is on. When applying therapeutic modalities, we need to consider physiological effects, indications, contraindications, and intensity levels. Key intensity levels include the minimum perceptible level, MPL, the maximum comfort level, MCL, the point of contraction, POC, and the point of analgesia, POA. Some general physiological effects of heat therapy include relaxation of spasticity, decreased myospindle response to stress, increased suppurative processes, enhanced vasodilation and hyperemia, increased pain threshold, increased local circulatory and metabolic rates, decreased vascular stasis, reduced diastolic blood pressure, increased urinary output, enhanced absorption of exudates, improved local nutrition and blood alkalinity, increased sweating, sedation, analgesia, increased blood volume, increased pulse rate and cardiac output, and enhanced lymph circulation. While not an exhaustive list, common indications for most therapeutic modalities include adhesions, bursitis, capsulitis, casalgia, contractures, contusions, dislocations, edema, epicondylitis, facet syndrome, fibromyositis, frozen shoulder, aged hematomas, intervertebral disc syndrome, muscle spasms, myalgia, myositis, neuralgia, neuritis, osteoarthritis, pain, periarthritis, non-occlusive peripheral vascular diseases, radiculitis, rheumatoid arthritis, sciatica, sprains, and spondylitis or spondylosis. Contraindications to most therapeutic modalities may include acute infections with fever and suppuration, bleeding states, brain injuries, burns, carotid sinus conditions, epiphyseal growth plates, eye injuries, non-set fractures, gonadal conditions, heart issues, impaired circulation or mentation, malignancies, menstruation, metallic implants, open lesions, occlusive peripheral vascular diseases, pregnancy, pyrexia, rashes, recent scars, spinal cord injuries, thermal nerve deficiency, active tuberculosis, undiagnosed pain, and areas treated with recent radiation therapy. Transitioning now to our focus topic for today. Low voltage direct current, also known as LVDC or galvanic current, is characterized by the continuous flow of charged particles in one direction. It is monophasic and monopolar, with a positive electrode called the anode and a negative electrode called the cathode. The anode and cathode have distinct properties. The anode is acidic, attracts oxygen, corrodes and hardens tissues, causes vasoconstriction and ischemia, and has analgesic and germicidal effects. In contrast, the cathode is basic, attracts hydrogen, softens tissues, causes congestion and vasodilation, promotes hyperemia, and can be irritating. Regarding specifications, LVDC has a frequency of 0 Hz, operates at 110 volts, and uses current density measured in milliamperes per square centimeter, mA per square centimeter. The cathode maximum is half a milliampere per square centimeter times the electrode area, while the anode maximum is 1 milliampere per square centimeter times the electrode area. The wavelength is greater than 1 second, with a penetration depth of approximately 1 inch. Heat propagation occurs via conduction, and typical treatment times range from 15 to 20 minutes. The primary physiological effects and indications for LVDC include iontophoresis, which is the process of transdermal drug delivery using a weak electrical current, and denervating muscle tissue. However, it's important to note any contraindications specific to the patient's condition before applying this modality. In terms of application, the active electrode, which is smaller in size, is placed directly over the injured area, while the inactive electrode, larger in size, is positioned within 18 inches of the active electrode. While we as chiropractors will not be utilizing iontophoresis directly, it's important to understand the concept. Iontophoresis involves the transdermal delivery of drugs using a weak electrical current, typically LVDC. During iontophoresis, the intensity can range up to 4 milliamperes, and the treatment duration depends on the current amplitude. Precautions include potential allergies to the ions being delivered and the need to reverse polarity every 5 minutes to prevent potential adverse effects. In summary, direct current flows in one direction, either positive or negative. The anode and cathode have distinct qualities, with the anode being more suitable for acute conditions and the cathode for chronic conditions. Key indications for LVDC include iontophoresis for transdermal drug delivery and denervating muscle tissue. That concludes our lecture for today. Thank you all for your attention, and I look forward to our upcoming lab session where we can further explore these concepts in a practical setting.